Hi, and welcome to this presentation about the Master Population Health Management. My name is Manon, and I'm a second-year student in the program, and I'm here today with Jeroen and Anna. Jeroen, maybe you can start with introducing yourself.
My name is Jeroen Struijs. I'm working at the campus in The Hague, and I'm teaching in the Master Population Health Management. I'm doing the block Alternative Payment Models.
Thank you. And Anna, maybe you can also introduce yourself.
Yeah. Hi, I'm Anna. I'm the study advisor of the Master Population Health Management.
Okay, so today the three of us will take you on a presentation about our program. We first will start with talking about what population health management actually is and why it's important. And in the second part, we will go further into the practical information surrounding the curriculum and also the admission requirements. In between these parts, we also have Q&A sessions. So if you have any questions, please feel free to ask them in the Q&A box. And if you see a question that you like, you can also give it a like, and then we know people find this interesting. So we will try to get to as many questions as possible during this presentation. So now, for one of the most important parts, let's talk about what population health management actually is. Because I remember as a bachelor student, I also didn't know what it was before visiting the open day. So I can imagine that you feel the same way. So we want to start by showing you a little clip about what population health management actually is.
This is our health system that faces major challenges such as staff shortages, aging, and increasing costs. Did you know that despite our diverse population, our entire health policy is based on the average white male aged 65? This policy is causing the health system to stall. We are getting older and older, but with fewer personnel, it's getting harder to keep up with the same quality requirements. There is also a lack of cooperation due to island formation. With the LUMC Master Population Health Management, we are going to bring about sustainable changes. We want to know which population groups come to the hospital and how we could have prevented this. By looking more closely at individual cases and applying that knowledge to a similar population group, we increasingly assume customization aimed at prevention. Take, for example, old people who fall at home. In the past, an orthopedist had the most economic interest in setting new hips. Now he tries to prevent this by stimulating the modification of houses. Or pulmonologists who are endorsing buddy projects to help patients break out of isolation and gain healthier lifestyles. Or creating green playing fields in socially disadvantaged neighborhoods to prevent children from ending up at the pediatrician. By using sophisticated data techniques for certain population groups, we are being able to indicate which intervention is most effective to create more sustainable solutions. And finally, we prevent fragmentation and endorse cooperation between health and social care providers. So, are you a bachelor student who can think in a solution-oriented way and want to contribute to more sustainable solutions for health and care? Then this master is really something for you. Go for more information to universiteitleiden.nl/phm.
So hopefully this video gave you a little bit more of an idea what PHM is. But Jeroen, maybe you can tell us more about it.
Well, population health management, and often I get the question like, what is it then exactly? How do we define it? I don't know whether that's the right question actually. And what we did already a long time ago is that we looked at what kind of definitions are there in the literature. And there are plenty and there are many, but and they are quite diverse, but there are some central things which are in all those definitions. So the question is probably not what is the right definitions, but what are some kind of the core elements of population health management. And that I wanted to talk with you about. I'll repeat a little bit of the video, but I think that you are totally aware of that we have challenges in healthcare. Resources are running out, people are getting older, we have a shortage of personnel. There's a lot of technological improvement. We have new medication, new all kinds of imaging kind of things. There's new data, so there's new things are there. It's challenging, and I think that population health management want to give some kind of an answer to that. And we do that by acknowledging that health problems are not equal distributed among the population. So we have a lot of people, I think we are doing quite well. We don't need to do that much about, it's about self-management, it's about education, but there's also a group maybe a little bit more or middle risk on certain kind of things, and we have a group who really needs a lot of attention. And thinking about those strata, so how can we risk stratify those groups? How can we identify a group who really needs something more than the others? This little figure here shows you that the little boy, and when we get all the same, he cannot look into the fence, but when we do a little bit of risk stratification, he can also look over the fence. So the adult doesn't need that much, the child a little bit, and the small child needs more. I think you need to think in this kind of reasoning to your population. Okay, who has a high risk on, I don't know, diabetes? Who has a high risk on maybe become frail and become, I don't know, and a higher risk for having a total hip and total knee replacement, those kind of things. I think that we are somewhere on a turning point in that we don't think more about, okay, in sickness and thinking about how to deliver care, but that we need to go forward in the sense of, okay, can we prevent, can we go to prevention, and how do we do that, and how do we pay for that, and how we pay for healthcare. I think that is a little bit my expertise, and then we really have a problem in the sense like, okay, what kind of are the overarching system goals we have, like affordability, quality, improving health outcomes, and how do we pay for that healthcare to our providers? So we have a misalignment between the way we pay for our the way we pay our healthcare providers, and that's totally misaligned with the overarching system goals we have. And we can think a little bit smarter, and in the sense of, okay, can we pay in such a way that the overarching system goals are aligned with the way we expose providers to their financial incentives every day. So it's about governance, it's about data, it's about how do we pay for healthcare, a little bit of health economics. And I think that's where all population comes together. So it's interdisciplinary. We are trying to identify populations and to manage the health of that population. It's for sure quantitative, but for sure also qualitative. We acknowledge, I think, that we need to do it together in co-creation with the community and providers, that we need to think about aligning those financial incentives, and that we also need to think about the governance structure. So in this master, you are not becoming an expert in health economics or an expert in governance or an expert in data science. I think that we teach you to become some kind of a generalist in between, so that you understand health economics, that you understand and can talk to people from maybe data science or the governance, so that you become that that person in between, with the overall goal to contribute to the necessary change we have. In the long run, it's not sustainable what we are doing now. I think also that your job perspective are great. They are looking for people, not just only the specialists on the specific themes. They are just looking for person who can connect social care together with healthcare, can connect policymakers with the data scientists. That's what we are doing here, and I think that's great about our master. Some kind of the career examples. That's what it is. If you have questions, please let me know. For sure, I think this is a growing market in people we need to make that necessary change.
Okay, so thank you for your explanation, and we want to see if there are any questions already. So let's take a look. Okay, the first question, health economics is a big topic. How much attention is given throughout the master to this topic? And can you specialize in this topic if this has your personal interest? I think from a student perspective, health economics comes back mainly in alternative payment models, so your Jeroen scores. And otherwise, it's important to look at the money when you're making an intervention. So I think it comes back in all courses, but mainly the alternative payment model course focuses really on it. And if you want to specialize this in this topic, I think that's really possible. But maybe Jeroen can give some examples of how you can specialize in it.
Yeah, maybe I want to add in that sense that health economic is for sure not where we start. I think we start in medicine, we start in prevention, but we are not ignoring the fact that, I don't know, a GP or a medical specialist is working in an environment in which financial incentives are important. So it's, in that sense, it's in the course, but when you look to other masters, let's say health economics, their starting point is health economics. And be sure, I think it's good for you to understand that our where we depart is really in medicine and prevention, but acknowledge also the other parts. I think that's what I want to add in this one.
Okay, great. Let's see if we have any other questions. Okay, the Dutch health sector still generally require the Dutch language from non-Dutch speakers in job search. Do you consider incorporating any level of Dutch in this course? And what would be your career advice to non-Dutch speakers? Maybe Anna, you know something about this?
I can say generally now that we haven't incorporated the Dutch language in our courses, but my biggest advice for non-Dutch speakers in this course is to really network as much as possible to begin with. So get in touch with the teachers of the course, ask for their connections, ask also for their international contacts if you're interested in going abroad. Our teachers are really open to that. So if you find yourself thinking, hey, this might be a point where I just need to get through and I have questions, don't hesitate to reach out to people and begin by networking straight away. Yeah.
And I also think for the course itself, there are also not only Dutch examples used, but also a lot of international examples. So it's not primarily Dutch focused or Netherlands focused. So I think for non-Dutch speakers, that's also really doable.
Yeah.
Okay, how large or small is the student population for this program? So I think my year there were around 25 people, and I think this year is kind of the same.
Yeah, this year we started with a cohort of 22 students, and yes, that is a small cohort, but on the one hand, you may think, okay, that's small, but on the other hand, I think it's really nice because you have a lot of chance to collaborate with different people. There's lots of room for discussion, maybe more intensive discussions that you would actually have than you would have with a bigger master's program. So I really sometimes feel that that's in the advantage of the master programs as well.
I think it's also important to name that there's no maximum for the number of students that can participate each year. So it can get a lot larger. And for the final question for this round, what are the main subjects? I think...
Yeah, so I will take you through the curriculum in the next part of the presentation, and there I will also ask Manon some of her experience with the subject. So we will come to your question in just a moment.
Okay, so let's now continue to the second part of the presentation. We will give you more practical information. As Anna said, she will start with talking about curriculum, so let's do that for now.
So in your first year of population health management, you can see here an overview of the 2 years. In your first year, you will take a broad spectrum of courses, which really will give you a broad basis in the field of population health management. You will start with the course Fundamentals of Population Health Management, which really introduces you and gives you a solid basis on the concepts in population health management, which you can then also use and apply in your later courses. Good to know is that the colours of the courses also correspond to how they are linked. So if you look at study design, then the follow-up course to that is responsible data analytics, and the same, for example, with governance. Then the follow-up course to that is alternative payment models. Alongside each of the courses, throughout year one, you have a project case where you work with a group and you work on your professional and personal development. Year two is completely free. You choose a focus area, either in data science, epidemiology, governance, or syndemics. And that's really up to you how you decide to fill in your second year. And you submit a second year plan, and you can take courses, you can do an internship for 30 credits, or you can just do courses, you can combine the two. It's really up to you what you decide. And then you finish with a final research project of 30 credits, which is your thesis. And maybe Manon, you could say which course was your favorite and why?
I also think this is a hard question. I would say predictive analytics and alternative payment models were my favorite, mostly because I didn't know what to expect in these courses, and I was pleasantly surprised that I liked them so much. And I also really like that you have the project cases that are semester long, so you really get the opportunity to work on longer projects and not only short projects for a few weeks. So that really helps also bond with your group and really work together on the long-term goal. So now let's take a look at how all the courses are built up.
So in weeks 1 and 2, you will follow the courses online. You will have online education, and you'll meet regularly with your group. There'll be self-study, peer reviews, consultation hours, and this is all done online. And then in week 3, you meet for an intensive group week on campus from 9 till 5, Monday to Friday. And you apply what you have learned in weeks 1 and 2 in practice in the on-campus week. And then in week 4, it's an individual week where you complete your final assignment for the course.
And I think for me that this structure is really nice because the first 2 weeks and the 4th week are really flexible. So for me, I also worked next to the first year master, and it was really easy to combine the two for me since it was so flexible. And the 3rd week is really nice because you are there a lot for 9 to 5. It's a really intense schedule, but it's also really nice to come together each month with all the people in the group, but also with the teachers, because you get a lot more one-on-one contact and able to do discussions more in real life. So maybe Jeroen, you can say something about how the on-campus weeks were for you.
Yeah, at the end, I think the on-campus weeks are the nicest weeks for sure. And in week 1 and 2, we had a lot of things and knowledge already received, which we try to apply in week 3. So in week 3, it's all about small groups, working groups, having discussion, work on a case the whole week. And when you go to my course, then we will design together a real life case. We ask health insurance, we ask the municipalities, okay, where are your problems? What is happening here? And you start designing your own alternative payment model. And at the end of the week, on the Fridays, we present that to the health insurers and to the municipalities. And one of the cases now is really probably get implemented in the next coming year. So I think it's a real life case. It's small and some kind of a flipped school idea. So you learn in the first 2 weeks online. There's a lot of knowledge there. And in the 3rd week, you are going to apply. And that's, I think, from 9 to 5 all together, working on a case and having on Friday that presentation to the health insurers. I think that structure works quite well. I like it.
Yeah, well, me too. So let's move on to the admissions.
Yeah. So there are some bachelor programs with which you will be directly admissible to the Master Population Health Management, ranging from medicine to health and society to public health. If you have another bachelor program, the Board of Admissions will evaluate your application and your previous education. We do expect to have some knowledge of medicine and quantitative methods, and based on your previous education, you may be required to take a bridging program in medicine or quantitative skills, each worth 12 credits during the first semester.
So, and now most importantly, the application deadlines. So for February 2024, it's still possible to fill in your application. If you need a visa or residence permit, you have to do it before October 15th. And if you do not need this, it's November 15th. If you want to start next year in September, if you need a visa or residence permit, you have to apply for before April 1st. And otherwise, you can apply at May 15th. So let's see if there are any more questions left. Okay, the first one. To me, the objectives of this master seem quite similar to that of the Master of Economics, Policy Law and Erasmus. How exactly would you say these two masters differ? I think, Jeroen, you have an answer for this?
Yeah, and I will repeat a little bit what I said already. I think the starting point in health economics policy and law is really, at the end, health economics. And here the starting point is really coming from medicine and public health prevention, health promotion. So I think maybe there's a lot of overlap in the sense of the topics, but your starting point, I think that's the main difference, I would say. Each year I also give guest lectures at HEPL, and I think here you are a little bit more in the sense of providers, a little bit more in the sense of maybe policymakers, and I think in HEPL it will be a little bit more students who are interested in health economics.
Yeah, so I think for population health management, it's important that you start from the bottom up. So you look at the patients, you look at the population and build from there and end up maybe at the policy level. And for health economics, policy and law, you do the exact opposite. So you start with the policy level before and not really looking at the patient level. So let's see if there's another question left. How does a personal development course look like? I think this is a new one. I didn't have this one yet in my year, so maybe Anna, you can say something about it.
Yeah, we don't have a, maybe that was unclear in the curriculum, but it's not a personal development course per se, but throughout each course that you take during population health management, you receive guidance from academic skills trainers at the Leiden University Medical Center to help you with your career goals and your academic skills. You are also coupled with a tutor throughout your time during population health management, and you have one-on-one meetings with your tutor, and he or she also guide you in your personal development. What career goals are you looking for? How can they best assist you with what you also want to do for your internship, your thesis? How do you go about that? So it's coupled with courses, and you have a one-on-one meeting with your tutors as well.
So why is the education completely online in week 1 and 2 and not on campus as well? I think the goal was for population health management is that it's really flexible, and I think that's why week 1 and 2 are online. For me, I was a really bit worried that you might not have contact with the other students during these weeks, but I think that's not the case. I know a lot of people from my year also studied together during these weeks, and we also kept in touch during this week. So it's not that you're completely on your own, you still work together a lot. But it's just that it's more flexible, and that the on-campus week is really the only week that you have to be there to make the whole program more flexible. So I have a Master's in Health and Society from Wageningen. Would you consider me eligible for application?
Yeah, based on the list of directly admissible bachelor programs, I believe you would qualify. The only thing is we cannot assess your application until you have submitted it. So my advice would be, if you are considering this master's program, submit an application and the Board of Admissions will look at it, and yeah, they will come back to you with feedback or extra requirements that you might need to take.
So where do the lessons take place of this master's study? So the online weeks are fully online, as the word says. So the lectures in this part are really short, like 10 minutes, maybe 15. It's really long already. So it's really short clips, and between that you have a lot of questions and articles you can read. So it's not a lecture that you maybe use for your bachelor, but it's really small, and I think it helped me to really comprehend the materials in these courses, because it's really short and you can really understand what they are saying before moving on to the next part. And the on-campus week is really on location in The Hague the whole week. And then there will also be some lectures, but that's all on location. So what are the job perspectives and how fast do graduates find a job? I don't know if you...
I think maybe Jeroen would be better to answer this question.
Yeah, I think your job perspectives are great, but I think the same holds for other masters. I think that we are now in a time period that there's a shortage of personnel, and especially people with the curriculum like the Master of Population Health Management. I know that quite a lot of the students from this year already had a job before they actually really ended their study. So I think your job perspectives are doing well. I'm working at the LUMC and the campus in The Hague, but also at the National Institute for Public Health and the Environment in the Netherlands. And one of your students here will start working at the National Institute.
So, is there a high demand in the Netherlands for population health management jobs, and where can I work after having a master's in health management? Well, I think we kind of answered that question, that there is a lot of jobs.
Maybe just an example. So we have one now who's working at a health insurer. We have one at the national government, but it's also at the municipality level, I would say, but also consultancy. I think that's one of the great things of this master, that you are not an expert in one specific topic, but that you are some kind of a generalist in multiple topics, and that's where your perspective of having a nice job is actually quite great.
Yeah, and I think for this master in the second year, it's really flexible, so you can already look a little bit for internships that you might like, so you can really figure out what exactly you want to do with this master's. So I think the second year is also great for doing that. Okay, let's see if there are any more questions left. Why is the master's study called Population Health Management and not a more regular name Public Health? And what's the difference between the two? Jeroen, do you know?
I think there's a difference in public health in that sense compared to population health management, and that's to keep it simple. Public health is really looking into risk factors, like high blood pressure, I don't know, all those kind of things. But here our focus is on what it says on the population. So can we risk stratify a population with a higher risk, and can we tailor intervention to that population? I think that's one of the key differences between population health management, but in the course fundamentals of population health management, I think this is one of the things we try to explain to you quite extensively, why we should look different compared to public health.
Yeah, and I think for public health, it's really focused on one sector, and population health management can also be implemented in other areas, especially in a hospital, on an ER, really specialized departments. So I think that's a big difference between the two, and I think they both really complement each other, but don't really mean the same thing. So I think this is our last questions. Are there available scholarships for the program?
My recommendation, if you have a question regarding scholarships or funding for the master's program, is to check out there are some general scholarships which are offered by Leiden University. If you want, you can send an email to masterphm@lumc.nl, and we can send you the links to that, or you can send an email to my email address, studyadvisor@phm@lumc.nl, and I can get in touch with you more about that as well.
So this is our presentation we wanted to share with you. If you still have any questions left or want more information, you can go to our website, and you can also find the chat with the student function there, and you will see my photo pop up. So there you can ask me all the questions that you still have, or have questions about my personal experience, or if you want to get in contact with anyone else in the program, I can also help you with that. We also have an experience day coming up this November 16th. And on the day you will receive a lot more information about the master, but also really experiences how it is to be a student in this program. And even if you have any questions left about application, admissions, you can also visit our website. And you will also find Anna's email address there to ask her any questions. So this was our presentation. We want to thank you for being here, and we hope to see you soon on the experience day or next year as a new student.